Mental health care traditionally operates through classification. To build a targeted treatment plan, clinicians sort complex symptoms into distinct categories. The first of these categories covers psychotic disorders. These conditions change how a person perceives the world, often involving hallucinations or delusions that exist outside of shared reality. The second category involves mood disorders. These govern a person's internal emotional state, manifesting as the crushing weight of clinical depression or the frantic high-energy state of mania. Maintaining these boundaries is a clinical standard. Historically, the effectiveness of a patient's therapy heavily depended on identifying which of these two separate tracks their symptoms followed. However, a significant clinical challenge occurs when these two categories clash. A patient may arrive at a clinic experiencing severe, acute symptoms from both tracks at the exact same time. In these cases, a person might be navigating active hallucinations while simultaneously enduring a profound manic episode or deep depression. This overlap obscures the standard diagnostic path. Because the symptoms are so intertwined, it becomes difficult for a clinician to determine which condition is driving the patient's experience. Getting this distinction wrong has consequences. If a clinician treats only the mood but ignores the psychosis, the hallucinations remain. If they treat the psychosis but miss the depression, the underlying emotional crisis goes unaddressed. Inaccurate categorization leaves the patient trapped in a cycle of treatments that don't fit. This specific, blended intersection of symptoms has its own name: schizoaffective disorder. It is essential to recognize what this is not. It isn't simply a case of schizophrenia, nor is it just a subtype of bipolar disorder. It is a unique, fused condition. It requires a specific clinical approach because the symptoms aren't just happening alongside each other, they are part of a single, integrated illness. To identify the proper path for care, clinicians must look past the immediate symptoms and find a specific chronological differentiator. Licensed clinicians use time as the primary lens to separate these intertwined symptoms and reach an accurate diagnosis. This timeline shows the clinical process. A professional tracks the patient over several weeks, specifically watching for what happens when the major mood episode begins to settle. The defining moment occurs here. As the mood line returns to a stable baseline, the clinician watches the psychotic symptoms. In schizoaffective disorder, the hallucinations persist even when the mood is stable. For a formal diagnosis, these psychotic symptoms must remain present on their own for at least 2 weeks after the mood episode has ended. Identifying this specific delay in symptom resolution is what allows clinicians to confirm the diagnosis with certainty. This distinction is vital because it changes the recovery strategy. It allows for a specialized plan that targets the specific neurological and emotional architecture of the disorder. With the right diagnosis, the path forward becomes clear. People with schizoaffective disorder build careers, sustain families, and live full, meaningful lives. Stability is built on a two-pronged approach, supporting the patient from two very different but equally important directions. The first prong is psychiatric care. This focuses on managing the biological and psychotic symptoms through medication. The second prong is specialized therapy. This helps the individual navigate daily life, process their experiences, and bring the family in for a stronger support network. Effectively managing a complex diagnosis requires this kind of integrated care. No person or family should have to navigate the recovery process without a guide. Coping and Healing Counseling is a Georgia-based practice equipped to manage this level of clinical complexity and coordinate comprehensive care. Their team includes over 15 licensed therapists, including clinical social workers and family therapists, offering specialized support for individuals, couples, and teens. They work to make this care accessible through a 100% HIPAA-compliant telehealth platform, accepting major insurance and providing $0 copays for Medicaid members. If your family is navigating this diagnosis, you can reach out for support tonight. Visit chctherapy.com or call 404-832-0102 to begin the path to healing.